Hello, I'm Mike Franz. I'm Medical Director of Behavioral Health at PacificSource, and I'm here today to give a COVID-19 update, an overview of managing your mental health. So COVID-19 can feel overwhelming for all of us. There are changes to routine, financial pressures, uncertainty now and in the future, social isolation, and a fear of getting sick, whether it be ourselves or our loved ones. All of this can bring on stress, fear, uncertainty, loneliness, sadness, and all of this can be exacerbated if we already have underlying behavioral health conditions. So today I'd like to talk about some self-care strategies. First, we'll talk about taking care of our body. Then we'll talk about taking care of our mind. Then we'll talk about social connectedness. And we'll end with talking about when there are signs that we need more help and how to get it. So let's talk about taking care of our body. Sleep is really important, and it's really important to have a consistent routine where you try to go to bed at the same time each night and get up at the same time each morning. It's also important to limit caffeine intake in the afternoon and evening and try to do a relaxing activity before bedtime. That's not the time to exercise. But speaking of exercise, we do need physical activity to keep our bodies and our minds healthy. And you're able to do that during COVID-19. You can do videos that do yoga or Pilates. You can get out and walk and other exercise as long as you're practicing physical distancing in a safe way. We also need to eat healthy. We need to put down that bag of Cheetos and try some healthier foods like fruits, vegetables, and some healthy proteins as well. We need to limit our alcohol and other substance use during COVID-19. While it's tempting and might provide some immediate relief, in the long term, it's only going to bring on more problems, stress, and anxiety. We need to limit our screen time. Get away from Netflix, get away from your computer screen, and do something else during the day. Relaxing and recharging is also critical. I'm fortunate I have a hot tub, and I've been using that a lot more. Whatever works for you, do it. Now let's talk about taking care of our mind. Keep a regular routine. Not just sleep, but this also means a regular routine for your work, or for your studying if you're a student, or your meals, or the time you spend with your family and friends. Limit your exposure to news media, especially those sites that aren't very reputable. Stick with the World Health Organization or the Center for Disease Control. And don't focus just on statistics, but more on the recommendations of what it takes to stay healthy. Stay busy, be productive, stay active. You don't want a lot of downtime right now, but it is okay to take those quiet moments and do some meditation and recharge your mind. Focus on positive thoughts. Wake up each day, think of or create a list of things you're grateful for, the people you love, and what's still going well in your life. Stay true to your values, keep your priorities, follow up with your spiritual needs, and follow your morals. Connect with others. There's a misnomer out there called social distancing. This isn't really what's required to reduce contagion. We need to physically distance, but we can stay socially connected. And we can do this through phone calls, your favorite social media, or video apps like FaceTime and Skype. Altruism is really good for your mental health, and now's the time to practice it. There's plenty of opportunities. The elderly are in great need of help. If you can bring someone groceries or bring them their prescriptions, you're doing a lot and you'll feel better about yourself. If you know someone who's really socially isolated, perhaps they live alone, reach out virtually to that person. Despite all these self-care efforts, sometimes we still need more help. For example, if we already have an underlying behavioral health condition, whether it be a mental health issue or a substance use issue, we need to stay on top of our treatment plan, connected with our providers, taking our medications if they're prescribed. Even if we don't have an existing behavioral health condition, this type of stress can bring one on. So if we notice that we're having more depression or anxiety or increasing our use of substances, and this is lasting for days at a time, and it's starting to interfere with our functioning, such as relationships or job, it's time to reach out and get professional help. And finally, and most importantly, if there's a safety concern, if you're experiencing suicidal thinking or you have a loved one who is, or you're experiencing a lot of anger or seeing anger in your home to the point where you're frightened, this could be a risk of interpersonal violence, and you need to get some help. So when we need help, what do? Well, there's some great news. Telehealth is more available than ever, and it's very likely your primary care provider, your behavioral health professionals, and other medical support staff can reach you at your home using video and audio by just zooming in over your phone or your computer. Likewise, if you are a PacificSource commercial member, you have access to Teledoc. Please consider using Teledoc. A lot of employees, no matter where they work, have access to an employee assistance program, and I encourage you to use that. If you are feeling suicidal, please call the Suicide National Hotline number on the screen or web chat with the web address on your screen. Likewise, if there's risk or you're experiencing interpersonal violence, domestic abuse, or child abuse in your home, please also reach out to the Domestic Violence Hotline available on your screen as well. I'd like to finish today with a promotion that May is Mental Health Awareness Month. And please look for more video updates from me and others like this in the coming weeks. The PacificSource Wellness team, in collaboration with the behavioral health staff here at PacificSource, will also be bringing you more programming and content throughout the month. So thanks for watching today. I'm Mike Franz, Medical Director of Behavioral Health at PacificSource.